This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.
Good evening. My name is Joe Sam Robinson. It's my pleasure to have with us tonight Professor Buck Melton. Welcome, Buck. Nice to have you with us tonight.
Glad to be back.
Well, you've been with us a number of times. I think we've had a pretty spirited conversation. And tonight, I think our subject is going to be some of the new federal regulations that are in the offing in regards to health care. Earlier, I think we discussed the idea that in this enormous Obamacare law that had been propagated, which was very complicated, that out of that, a whole series of regulations would appear that would be even more daunting to, understand. And maybe you could speak about some of those regulations that are in the offing.
Well, some of the regulations that you and I have been talking about earlier and off camera is this new idea that essentially a customer satisfaction survey that will be carried out by none other than the federal government.
Yes.
As to the experience and how well you think you've been treated by a doctor and whether or not the treatment's been efficacious.
Yes.
And one of the more interesting lines is if you feel that you have been disrespected culturally or socially by the doctor, which technically doesn't have anything to do with the treatment of it.
And also, I think it's any healthcare provider. So it could be a nurse, presumably anyone that's in the hospital that you didn't like the person's attitude. It would be possible to just contact the federal government and voice your complaint about that. Is that correct?
That's what the regulation seems to read at this point. So. Now, these things may change over time, but there's a very interesting list. And the thing that really struck me as a professor is how similar this sounds to the student evaluation process. Any of your viewers who have been in college know the last day is taken up with rate your professor.
Oh, I thought it was the converse. No, you don't give grades these days. It's just the students' grade. You
have to be careful with the grades you give, or you'll get a bad. You'll get a bad evaluation.
I've got some jokey stories on the subject myself.
So yes, but that is interesting because I've long been fond of saying that in education, your customer is your end product, which leads to a very interesting relationship. I think probably the same is true of medicine to a degree.
Yes.
And so these new regulations are asking the customer to weigh in on how good a job the healthcare provider has done. And the lead question is the customer really qualified to do that? I mean, obviously the customer is qualified to say that he feels sick or something is wrong, but that's in large measure different from saying that the doctor committed malpractice or left a sponge in or something like that. So.
Well, just to discuss the situation in a little more detail, these regulations apparently have just appeared without any kind of legal. The Congress has not said, let's do this. There have been some bureaucrats that did it. How exactly does that work? And how do these, we'll sail into the legal world about remedies and what happens. So traditionally, is there a remedy, just to ask this question, is that if you enter a hospital and you believe that in some ways you've been, to use your turn of phrase, disrespected. I mean, this thing happens in bus stations, it happens walking down the street, it happens in domestic situations. Maybe there's a sense that maybe a family member was not appropriate. Yeah. So this is part of human interchange, but what happens now? What happens? I mean, you just feel like I didn't like the sense of disrespect.
Yes.
What's the remedy?
Well, if we're talking not even about medical treatment, but disrespect, or I didn't like the person, or whatever. Well, the traditional answer, the market solves everything. I didn't like that doctor, I'm not going back. And I have actually been in a situation where I didn't like a healthcare provider's attitude. And that's happened a couple of times. And so the market will decide. He'll lose patients and he'll straighten up his act.
And what about in bus stations? If you feel like you've been not appropriately treated in a bus station, what's the remedy there now, President?
Well, it depends what appropriate treatment is. I mean, if there's some sort of actual damage involved.
You felt you didn't psychologically impinged upon by treatment in a bus station.
That's life. The idea of the eggshell plaintiff, that a certain amount of bruising is going to take
Yes.
place in any society, and unless it reaches some sort of threshold level, then just
Well,
deal
so
with it.
isn't this part of human interchange? I mean, just human contact, just people, they meet each other in different sets of circumstances. Maybe a person is in a bad mood, either the recipient of the, I guess, ill will or the giver of the ill will. I mean, it's just impossible to always have two people, if one can say it, like each other. That's just not always possible. And we just accept the idea that's part of life now. Is that fair to say?
Yes, I do think that if you're dealing with a confidential relationship like doctor-patient or nurse-patient,
right.
I do think some allowance has to be made. You're really baring your soul, opening
Right,
yourself
yes.
up. You're being seen naked by
Sure,
strangers.
sure.
But at some point you have to ask, how far does that go? I mean, the natural remedy is if you feel disrespected, take your custom elsewhere.
Now,
So-
just to ask the question, I mean, we have, I guess, what is it, standards of impingement or standards of ill treatment that sometimes rise to other remedies.
Yes, yes.
Now the remedies are just for not, you just go somewhere else, you kind of just live with it. Is there a particular standard of ill will toward one that their system will respond to now?
Well, I think if you're getting to actual medical treatment, the normal thing to do would be a medical malpractice suit, which
But this is not, suppose there's no harm done though. So one thing that I'm getting at is just the nebulous nature of the government's intervention in the doctor-patient relationship, and how it's difficult to imagine a situation where disrespect presently rises to, assuming there's no physical injury,
Yes,
maybe there's
yes.
some emotional injury. I mean, I think if something really onerous occurred, it would be, there are remedies that exist. The medical society could be contacted, the hospital could be contacted, some just terrible behavior.
Well, if
there are
it's-
things that could be done now.
Yes, if it's a racist statement or something, then you're dealing with traditional tort law concepts like intentional infliction of emotional distress, negligent
Okay,
infliction of emotional
let's
distress,
discuss that. And suppose
defamation.
So there is a way, right? Besides just that, right now, patients, presumably, if a nurse was really coarse in their treatment, they would have a remedy now through the tort system. Is that correct?
Yes, and I think that's an important thing to note. About a century ago, Roscoe Pound, who is one of the great jurists in American, or
Yes,
great
yes.
legists in American history, wrote a fascinating series of articles called Justice According to Law,
Yes.
in which he really trumpeted the importance of the judicial system and
Yes.
in dealing in a one-on-one way with one-on-one
Yes,
slights.
yes.
And I think you'd be, if I understand the medical profession, it's not an exact science, and you don't guarantee results
Yes.
because there are too many variables.
Right.
So the court system is the ideal system to deal with that if you do have to deal with it. Now compare that to the direction that this regulation is going. It's not going to be a judicial remedy. It's going to be an administrative remedy, and that's the thing that Pound was scared about. You'll have some panel sitting somewhere, maybe with doctors on it, maybe not, who are not going to be looking at it in a one-on-one way, but in almost a statistical way.
Well, let's look at this. I mean, so administrative remedies that the government is inserting into the doctor-patient relationship. And so does justice enter the room when administrative remedies occur? Do the courts have purview over these interchanges? What power does the system allow for administrative remedies for alleged rudeness, shall we say?
Well, the administrative law and the bureaucratic system is, of course, the fourth branch of government.
Yes.
It has evolved in the last 120, 130 years. And you do see in some cases Article I courts. They actually work in an adversarial way, almost like a court, except they're not a court.
Yes.
But they have removed these issues from the traditional Article III or state court
Yes.
systems. And life's like what does Forrest Gump say? You never know what you're going to get, a box of chocolates.
Yes.
I think what you're going to end up seeing at best is the evolution of a parallel court system to the current medical malpractice system, and it's going to be staffed by experts, and you'll have a whole new body of law developed, and it will be completely inefficient because we already had that
Yes.
and decided not to use it.
Well, now, just discussing where the ship seems to be sailing,
Yes.
not so much in regards to whether physical harm has occurred, but the very nebulous nature of the government's reporting arrangements. Now, right now, there's not, as far as I can determine, there's no penalty for being rude. The government is just assembling data on the subject. Does the government have a sort of post facto ability to say we've gotten your name and we've decided to, whatever the penalty could be, we're going to send some people down to check and see how you're doing it, we're going to withhold payments, they will monitor your tax returns. What about that? What about penalties that administrative arrangements can inflict post facto toward any kind of
Yeah, well, once again,
perceived?
in trying to answer that, I'd once again start with where we are rather than where we're going. And where we are now, there's a tort called tortious interference. And
That sounds threatening.
yes, well, one flavor of it is with business relations.